Naomi Kingery, the Diabetic Diva here. I realize that some of you watching may not know what diabetes is. You've probably heard of it on the media or someone in your life has it, but you don't really know what's involved in the life of a diabetic. So I'd like to share that with you today. There's two kinds of diabetes, which not a lot of people realize. Type 2 diabetes is the most common. It does happen more often in those who have obesity. And I do want to preface this though and say that type 2 isn't only caused by obesity. There are other issues that arise that can cause this. So with type 2, what happens is your pancreas, which is the organ behind your stomach, it has beta cells that produce insulin. Insulin is a hormone necessary to live. And what happens is if you were to right now eat an apple, your insulin would start to kick in. When that sugar hits your system, the insulin would bring your blood sugar back down to a normal number. In type 2 patients, though, their bodies have to work harder. They have so many layers of fat in their system that the insulin comes out of the beta cells, but the body doesn't know how to respond to it. And so the insulin is working, but maybe it's not working as well as it should. It's acting a little bit weaker. And so in type 2 patients, a lot of people, if they do have it because of obesity, they can really work hard on that diet and exercise, and they could basically cure themselves. That's type 2. Type 1 is more serious. It's something that I will say doesn't happen because of a choice, because of bad choices with diet and exercise. Type 1 occurs a lot of times in younger patients, but they do see that it happens in those who are older too. Type 1 diabetes can happen either because somebody in your family has it. So it could be passed down from generation to generation, usually it skips a generation. Or it can happen because your immune system is attacked by something in your body and the beta cells just stop working. What happened in my case is a couple of months before my diagnosis, before I started to show the symptoms of diabetes, I got tonsillitis. And that tonsillitis began to attack my body, and my immune system was so weak that the beta cells just one day said, I can't do this anymore, I can't produce insulin. And so in type 1 patients, they have to then administer that insulin either through injections or an insulin pump to make their body stay alive. So that's the difference between type 1 and 2. Type 2 can usually be treated with pills or just with diet and exercise. If type 2 patients don't focus on their health, it can turn into type 1 symptoms where they need insulin. Type 1, we do all need insulin to stay alive, which is why we're hoping for a cure. So I'm hoping that I cleared up that for you today, the difference between type 1 and type 2. Type 1 is what I have. The American Diabetes Association says that every 20 seconds somebody's diagnosed. So it's a real problem, and it's something that needs to be cured.